Sorry, I'm just setting it up. Okay,
Okay.
injured muscle. Yeah, so what are you thinking?
Okay, I will start then. Thank you.
So what are you thinking about? We have shoulder pain, picture, significant pain in the right shoulder, right?
Okay.
And mild tenderness in the right shoulder. So we have tenderness and we have significant pain upon movement. And so the abduction of the upper extremities.
Okay.
Concentrated around the right shoulder area. Pain is described as achy and dull. Intermittent 7 out of 10 pain. Okay, so look at these tests really closely because I think this is like, what this question is really asking us, I think, is if these nerves were gone, if we didn't have these nerves, how would we expect their ability to move around and to use their arm to change? So.
Actually, I did not study anatomy, but I'm thinking we were just thinking about the recoil, so the person is in the abduction. So maybe things like that.
Someone just joined here. All right, and so I have resist arm depression. So holding arms parallel to the floor with the thumbs pointed down, right? So arms parallel to the floor with thumbs pointed down, he reports significant pain in the right shoulder. So lifting his right arm. Mild tenderness to the right shoulder. So there's a few things that I'm wondering as I read this question, which is when you say lifting, do you mean flexing at the shoulder, which is to say raising it like the coracobrachialis would, or do you mean denies any significant medical trauma? So this is one of those situations where I think you need to make an association between the fact that he's a pitcher and kind of overuse injury that you get from pitching too much. And so there are some things we can rule out. So the long thoracic nerve would be used for like that would prevent that innervates the serratus anterior, and it would if you had a problem with that, you'd have like winging of the scapula. Your subscapular nerve is part of the kind of rotator cuff muscles. So this is like a rotator cuff muscle question. So the axillary nerve is going to be to do with you're going to be like pushing as if you were doing like a bench press is one of the things that you can do with your pectus, your pectoral muscles. And so I think it's better for us just to answer the question and read what they're getting at, because I don't want to mislead you. The thumb pointing down thing is bothering me. So let's see. What are you thinking about, and what do you want to answer? Do you think? You have less guidance than the rest because I'm not sure what the answer is here. Are you still here?
Yeah, I need to possibility of this.
You're saying which one?
I should think.
You say D?
C.
Is it B as in boy or D as in dog?
No, it's C.
C as in cat. Okay. All right. So how confident?
Absolutely yellow.
Yellow. Okay, let's try. All right, suprascapular. Yeah, so suprascapular is most commonly injured rotator cuff innervated by the is most commonly injured muscle of the rotator cuff. So if you have to choose one, the suprascapular is not a bad so the suprascapular is not a bad nerve. And so I think when they were saying raising your arm, so this is a classic question on the USMLE. I should have mentioned it before we just went into it, but like when you raise your arm to your side, so let's say your arm was at your side and you raised it directly out from your chest, that motion is governed at different degrees away from your spine. It is governed by different muscles. So the supraspinatus will start you off at 15 degrees, and then your deltoid takes over, and then your superior trapezius muscles take over. But you just remember it's the trapezius muscles. And so 15 degrees, and then most of your abduction of your arm at the shoulder is done with your deltoid, and then just the last like 15 or 20% of your abduction is going to be trapezius muscle. So they should have said abduction. This was not a question that should not have mentioned that you're abducting. But that's the subscapular is the same as your supraspinatus, and the suprascapular is the same as your supraspinatus, because it is the spine of the scapula that they're saying you're above. With supra, spine, suprascapular, right? All right. So thank you. That was a harder question. So that's there's no shame in that one, or any of the ones we got wrong. We actually did pretty well here so far. So anybody, Rowenda, do we have a random person to answer a question? Okay. Who's next? Saida? Okay.
Yeah, hello. Yeah.
All right, welcome. So, all right, I'll start us off, and you can read. We're getting attacked by this spider.
Yeah. Okay, so a 20-year-old man was brought to the emergency department with passive suicidal ideation. He said that these ideas started because his girlfriend recently broke up with him. He also said that for last 5 years, he has become increasingly jumpy and irritable when people approach him from an unexpected direction. He is also in danger of failing his college classes because he has difficulty concentrating. He also endorses having nightmares of being attacked from dark corners, and these dreams sometimes include into his walking life when there are really people attacking him. Of the following may be associated with patients most likely diagnosed with. Is this something like he's hallucinating because of the waking up with the girlfriend? Hallucination, maybe the C option?
So C would be auditory hallucinations. So let's pause for a second and kind of before we choose an answer, let's think like we got a guy who has passive suicidal ideation, right? Do you know what that is?
Suicidal ideation. No idea. Maybe I think like there's this man who just woke up and just thinking about like being suicide.
Yeah, he's thinking about killing himself, but it's passive in that he doesn't have a plan. So that's less severe than if he had an active suicidal ideation. But he's thinking about killing himself, so he's pretty seriously troubled or not enjoying life right now. So you're thinking like an affect disorder, like a depression, or bipolar or monopolar depression. So His girlfriend broke up with him though, and he says that for the last 5 years he's become increasingly jumpy and irritable. So it sounds like the breakup happened a long time ago. So when you look at psych questions, you should identify that it's a psychiatry question, and then psychology question, and then I want you to immediately think about how long this has been going on. That's like the first thing you want to think about for psychiatry questions. So for 5 years he's been jumpy and irritable. So so do you know the mnemonic SIGI caps? So SIGI caps is a mnemonic. You want to use some kind of mnemonic to remember the diagnostic criteria for major depression, because you always, when somebody's depressed and it's a certain time period, like below 2 years, you want to be thinking about major depressive disorder. So you want to be thinking about the characteristics of major depression, which are suicidal ideation. You want to have changes in sleep, concentration, appetite, mood. There's 2 major criteria, which is anhedonia and depressed mood, and then you need 5 of the minor criteria, including suicidal ideation, sleep disturbances, psychomotor agitation or depression. And so so this is a good illustrative kind of educational question. So does he have trouble sleeping?
No.
Okay. And does he have difficulty concentrating?
Yeah.
All right. Does he have depressed mood?
Yeah.
Does he have suicidal ideation?
I think no.
He does. He has passive suicidal ideation here. And it's been so long that it's not adjustment disorder, which would like be done within the first month or 3 months. And so, and psychomotor agitation he has because he's kind of irritable in unexpected directions. So the other thing to think about is potential, nightmares are a symptom of PTSD, an acute stress disorder. And he has difficulty concentrating, so a lot of these things overlap. So he feels like they are really attacking him during his sleep, nightmares. So he's having nightmares, he's having difficulty sleeping, increased jumpy and irritable, and it seems like they're brought on by psychological experiences, right? And so, knowing all of that, what would you choose as an answer choice?
E, I think it's either E or B.
E or B, okay, so we can rule out these guys. That's a good way to do it. So we're at 56 seconds here. Episode where patient gambled. You said B or E?
Yeah.
So associated with this patient's most likely disorder. So what do you think the disorder is to begin with?
Exaggerated fear of social situations. I think E.
But what do you think the diagnosis is before you go to the answer?
It's maybe the psychological problems related to like the nightmares. He's just socially inactive.
Like a night terror disorder?
Yeah, something like that.
Or so if you remember your nightmares, it's a night terror, and you tend to get those in PTSD. So maybe if he had PTSD, he might have an associated gambling excessively, or exaggerated fears of social situations, which would be social anxiety. So which one do you want to choose, and how confident are you?
I think I will go for the E one.
B is in boy?
No, the E one.
E is in egret. Okay. So what color do you want?
The yellow one.
Yellow one. All right, let's try it. So it sounds like it's A. So life-threatening childhood. So I think they're going with the fact that this is post-traumatic stress disorder. So one of the major associations with PTSD is that you have flashbacks, but you also have like night terrors that wake you up. So nightmares is a really big And hyperarousal is a really big. I think the most important thing here is the nightmares, and the second is hyperarousal. And then you need to know that PTSD, you need an event, you need something in your life that felt traumatic. It doesn't have to be traumatic, but it has to feel traumatic sufficient to have these other symptoms. And so you usually have a life-threatening childhood trauma or something very psychologically traumatic to get PTSD. The criteria for PTSD is such that you have to have it for longer than a month. So if you have it shorter than a month, then it's actually acute stress disorder. So that's a really good, those like psychology questions are really high yield, and they're really easy to get wrong. I was struggling with this one. So good job. Thank you for participating in that one. That one's a particularly difficult one as well. So Rowenda, who's next?
I have a question.
Yeah.
Before we move to the next question, if you go back
Yeah.
to that, where one of the options was best treated with therapy, are we like jumping the gun and thinking that it could be like a certain type of disorder that could be treated with therapy, or just because I figured it was
Yeah. That's a great question. By the way, if you guys have questions, that's what we're here for. So definitely ask. That's just jump in. The best way to think about it is these answer choices represent diagnoses. So the first thing to do is to diagnose the patient. So if you were under the false impression that this patient had major depressive disorder, then you might choose answer 2, which is B, because you're thinking, well, honestly, you would give them an SSRI, or cognitive behavioral therapy in addition to an SSRI, and so, but if they had refractory major depressive disorder, if they had suicidal ideations that were super severe, like active suicidal ideation, not passive, meaning they have a plan. They're like, I have a gun and I want to shoot myself, and that's what I'm going to do on Tuesday at 3 p.m. and nobody can stop me. That's active suicidal ideation. And so that's something that you might use electroconvulsive therapy for. You might also use it if you had refractory major depression that just wouldn't go away with treatment with SSRIs and CBD for a long enough period. And if it was affecting your activities of daily living and affecting your career, then you could consider getting electroconvulsive therapy. And I've seen patients who get shocked over 300 times throughout the course of like 5 years. And it's a pretty intense procedure. I had to do anesthesia for one of the procedures. It's pretty intense. So you wouldn't do this first line, which is to say you wouldn't do it the first thing you did, but this is the assumption is that this is major depression. And so, and it's very useful, electroconvulsive therapy for major depression, but you want to diagnose it first. Like auditory hallucinations would be associated with schizophrenia, episodes where a patient gambled excessively. I think that's to do with bipolar disorder. Yes, it is. And then exaggerated social situations, that has to do with like social phobia. And so fear of going into the public. It's not even association, that's a description of the disorder itself. So these are really, like, getting really serious about those definitions is how you do well in psych. So you just look at the diagnostic criteria and you really think, you know, can I justify this diagnostically? And then you go to the answer choice. You can't jump to the answer choice until you have a really firm idea of the diagnosis, and 99% of your questions is going to be not about treatment, step 1, but more about diagnosing. Does that help?
Yeah, definitely, that helped a lot. Thank you. And I was gonna say for the gambling thing, there wasn't anything mentioned in the question, so then I automatically just ruled that out. But that could also be considered. Is that what you're saying?
Yeah. So the thing is like, this is the point I'm making. This is like a really important point for test taking is the gambling wasn't mentioned, but these do not represent specifically the things that you would see in the patient or the diagnoses. These are associations with the diagnosis. So it's saying which of the following may be associated with this patient's most likely disorder. So the disorder is the first step. You need to know the disorder, but the association could be wildly different from the diagnosis, right? Because it's an association. So gambling excessively is associated with bipolar, but in order to be diagnosed with bipolar, you do not need to be excessively gambling, right? So
I figured it was like 20 years old, so I was wondering like how much could he have gambled if he's 20 years old? But yeah.
right. Well, I mean, he might not have gambled at all, and this could still be the answer.
Okay.
Because if he's bipolar and we diagnose him with bipolar, then he might get, as an association, gambling is something that you would do if you were bipolar 1, usually bipolar 1, which has the manic episodes. But you didn't see that in this patient, but you diagnosed him with bipolar, and then you said a lot of people with bipolar do also gamble.
Okay. Sounds good. Thank you so much.
Yeah. No, that's an awesome question, because that's test-taking procedure, and that's stuff that I often forget to mention. So thank you for that question. So Rowenda, do we have anybody next victim here?
Yeah, sure. Nana?
So, all right, Nana. If I mispronounce your name, let me know. Is it Nana? Nana, are you here? All right, Nana, I'm just going to put you in the waiting room for a moment, just so you can come back to us. All right, so we need another name, I think.
Yeah, sure. Let's go back to Shireen.
All right, Shreen. All right, so I'm gonna open the question. We're veterans now, so.
A 2-year-old girl is brought to a geneticist for evaluation of persistent development delay. She was born, I think this is the first question. She was born to a G1P1 mother at term via spontaneous vaginal delivery and scores of 9 and 9 at 1 and 5 minutes respectively. Since then, she has consistently missed her development milestones and does not appear to respond to verbal stimuli at home. On presentation, she is found to have birthing movements of her hands and arms bilaterally, as well as numerous wounds on her hand and wrist. When asked, her parents say that these injuries are due to self-fighting activity. Which of the following is most likely function that is deficient in this patient? So this is the one, I forgot what it was called,
Yeah.
but
Right.
I think the answer is E.
E. Yeah. So
I think it was
where do you think the wounds are coming from?
because she's self-harming herself.
Yeah. Yeah.
Uh,
So self-harm, 2-year-old girl, developmental delay, APGAR scores were low when she was born, so it's kind of abnormal. APGARs being low, when you're talking about developmental delay, it's like suggesting maybe a genetic abnormality or anatomical abnormality or something that's causing the delay. That it's hinting at that. It doesn't have to mean that, but an APGAR score that's below. Yeah, Lesch-Nyhan, exactly. So how is Lesch-Nyhan? What happens in Lesch-Nyhan? Like biochemically?
There's like hyperuricemia,
Yeah.
right? And then I guess like there's like excess of uric acid for yeah, that's hyperuricemia. Yeah. Like there's the I don't know, just know you're converting a type of something. I'm sorry.
So it's this really long enzyme name that you might be trying to remember that is just ungodly long, but it has to do with the salvage pathway, right? And so xanthine oxidation, so xanthine oxidase has to do with like you have adenosine, and then you have hypoxanthine, then you have xanthine, then you have xanthine's converted to uric acid, right? And then some of it is converted to allantoin in animals, and you can take a drug that would, if you had like tumor lysis syndrome, that would get rid of uric acid by converting it to allantoin, so you can urinate and get rid of it. But otherwise, the uric acid just goes in your blood, and it causes mischief. Like you can have kidney stones, or you can have very numerous psychological disorders to do with that, including developmental delay, mental retardation, and writhing of the hands and arms is very classic for Lesch-Nyhan. So we'll read about it. But what is the What is the confidence that you have that it's E?
Yellow.
Yellow? Okay, let's try it. Alright, so
I knew it.
yeah.
That's a different ship.
So this is like a perfect question because you're gonna see this all the time. I guarantee you that on an NBME or the actual USMLE exam, this is gonna be on it. So hypoxanthine guanine phosphorybosyl pyrophosphate. So you want to be able to recognize this. You don't need to like be able to like spit it out.
Is that like the PRPP or is that something else?
This is not PRPP. This is HGPP.
Oh yeah, HDPRT.
Yeah, HGPRT. So the phosphoribosyl, PR. And so this has to do with the salvage pathway. And I wish they had an image to show you the, because it has to do with PRPP, but it's not. That's not the enzyme implicated.
Mm-hmm.
It has to do with.
The HDPRT is absent because that's what converts hypoxanthine to IMP and then into guanine to GMP.
Yes, and so if you are, so that's when once you've gotten through that converting adenosine down to like IMP and things like that, you have these salvage pathways that will bring it back and use it as GMP and things like that. And so you get sand crystals in the diapers, really classic, hyperuricemia, and gout later in life is really common. They'll present with like really painful limbs from gout, tophaceous gout, and things like that. And so Lesch-Nyhan syndrome is, if you aren't comfortable with Lesch-Nyhan syndrome, you should spend as much time as you need to know the first aid kind of stuff about it, because self-mutilation, orange sand crystals in the diapers, and the enzyme name are crucial. You absolutely need to know them. So great job, Nana. Thanks for participating. So I was having trouble remembering that particular enzyme's name, HGPRT. So it is, yeah, hypoxanthine guanine phosphoribosyl pyrophosphate, or HGPRT. Hypoxanthine guanine phosphoribosyl pyrophosphate. So Rowenda, who do we have next?
Yeah, let's go back to Dr. Basim.
Okay, I'm here.
All right. Okay, so I'm gonna open another question. We gotta get some. We gotta kill this spider here. You ready?
Yeah.
All right. So, do you want to read? I can read if you want.
Okay.
All right, let's do it.
A 46-year-old man presents to his primary care physician with 3-day history of, I can't see the 3-day history of dark stools and sharpness of breath. He reports a 3-month history of epigastric pain that occurs 1 to 3 hours after eating, and is worse with spicy food. He has a decreased appetite and has lost 5 IBS. He smoked 1 packet of cigarette per day for 5 years but recently quit. He was in Dominican Republic for 6 months ago to visit family but denies any other travel or sick contacts. He had a history of tension headaches and irritable bowel syndrome. His medications include ibuprofen and probiotics. His temperature is 36.6 degrees Celsius. Blood pressure is 100/65. Pulse is 90 and respirations are 18. On physical examination, there is congenital. Let's see. After congenital of the color, his abdomen is tender on palpation in the epigastric area with no rebound or guarding. The remainder of the examination is unremarkable. Preliminary lab results are as follows: HP is 7.2, platelets 176,000, hemocolt 2 test is positive, leukocyte count and differential leukocyte count is 11,000. Segmental neutrophils 56%, bands 2%, eosinophils 1%, basophils 0.8, lymphocytes 35, monocytes 5. Upper GI endoscopy shows diffuse reddening of the gastric mucosa and a 1 centimeter lesion with a smooth and flat base located in the first part of the duodenum. What's the most likely contributed to this finding of endoscopy? So this is a patient who sounds like he's got a duodenal ulcer.
Nice. Nice. So you had as you were reading, you kind of formed a hypothesis. Yeah.
Which is bleeding.
Yeah. He's got low blood pressure, right? Conjunctival power.
Yes, which is bleeding, and his HP is also very low.
Yeah.
So he's got a bleeding duodenal ulcer.
Yeah. What do you think about this CBC?
So he's got raised leukocyte count as well,
Yeah.
and the rest are supposed to add up to 100. So they're almost close to 100. So
Lymphocytes a little high for normal. And usually neutrophils would be around like 70. You know, and this is veering on the side of being above normal. So this is like 11,000's the cutoff. So he could just have an infection, but lymphocytes specifically, that's interesting, right? And the gastric mucosa is red.
yeah, gastric mucosa is red, and it says it's a flat base, so it's most likely a benign ulcer.
Right. You said midline?
Benign.
Benign.
Benign, it's not a malignant ulcer.
Well,
Bleeding ulcer.
ulcers will be like. Oh, you're saying it's not bleeding.
It's bleeding.
It is bleeding. Yeah. So I wouldn't categorize in terms of terminology. I wouldn't categorize ulcers as being benign or malignant because I want to make sure that I reserve those words for cancer. And so they're accurate because you could say something is benign. Like I fell off my bike, but it was benign because I didn't get injured. That's correct usage in medicine, but I would veer away from it just because you can wind up describing, it in a way that somebody gets the impression that you think that it's cancerous when it's not, which you're not saying.
Yeah.
But we could consider cancer. We have lymphocytes that are 35%. Yeah, smooth, flat base located in the first part of the duodenum. So, what do these answer choices represent to you? On endoscopy, what is a gastrin? Yeah, so gastrin secreting.
Secreting tumor. It's a possibility. Oh, how old is the patient? 46.
He's 46. Yeah.
Okay, so he's not really in the age group of any tumor for now, unless otherwise.
Why does he have dark stools?
It's because he's bleeding from the ulcer.
Right. So that is melena, which is to say that this is an upper GI bleed.
Yes.
Right? So that's the category of what we're trying to decide. What's the cause of this person's upper GI bleed? And they went to the Dominican Republic 6 months. Yeah.
He's got infection as well.
He could have an infection, right? I mean, he doesn't have a temperature, but yeah. So his blood pressure is low. I mean, yeah. So what do these represent? You have urease production, which would be like uremic pericarditis, maybe. You have cyclooxygenase 1 inhibition, which would be like if you took NSAIDs and they decrease the gastric mucosa secretions, and you wind up getting, you can get ulcers from that, right?
Yeah, you get ulcers from that as well.
Right. And then ancylostoma duodenale, which is a parasitic infection. And then you have trophozoite-mediated tissue destruction. And gastrin-secreting tumor would be a gastrinoma in your pancreas. What do you make of these lymphocytes?
It's a bit high, so there could be some sort of infection.
What causes a duodenal ulcer?
Bleeding from the gastroduodenal artery, right at the back.
So duodenal ulcers are caused usually by H. pylori,
Oh yes, H. pylori.
right? And what is one of the tests you can do for H. pylori?
Is it urea breath test or H. pylori?
Exactly.
Test.
Exactly, urea breath test. They have radioisotope of urea that they give you, and if you are breathing out urea in excess because of the H. pylori production of urea, which is what they use to create a hospitable environment in your stomach and in your duodenum, then you will have a positive urea breath test. So which of these answer choices kind of goes along with your duodenal ulcer?
Very difficult question.
So he's taking ibuprofen.
For A,
Yeah.
ibuprofen is.
So is
A
ibuprofen?
and B.
Do you think ibuprofen's going to inhibit cyclooxygenase 1?
Yes, it's one of the possibilities.
Okay. Okay. And so, which answer choice do you like?
Maybe we go for B.